Rosvina Cara from BSN 3B. So for today's vlog, I am going to discuss to all of you about the fluid volume deficit, or known as the hypovolemic. I am also going to discuss its causes, signs and symptoms, examples, risk factors, and the treatment. Let's start first with identifying the fluid volume deficit. What is fluid volume deficit? A fluid volume deficit, or known as hypovolemic, is a state or condition that the fluid output exceeds the fluid input. And it occurs when the body loses both water and electrolyte. The common sources of fluid volume deficit are gastrointestinal tract, polyuria, and the increase of perspiration. The risk factors of fluid volume deficit are vomiting, diarrhea, gastrointestinal tract suctioning, hemorrhage, coma, burns, and decreased intake of fluid. A fluid volume deficit can be acute or chronic condition, but it can manage in a hospital setting, outpatient center, and a home setting. So this appropriate management is to prevent a potential life-threatening of hypovolemic shock. So what is this hypovolemic shock? This hypovolemic shock is an emergency that the severe blood and a fluid loss makes the heart unable to pump blood into the body. And this kind of shock can make other organs stop working. We have two examples of hypovolemic shock. First is refractory gastroenteritis and extensive burns. First one is refractory gastroenteritis. It is a rare disease that make the abdominal symptoms result from infiltration or eosinophils in the digestive tract. While the extensive burns, it occurs when the heat injury releases cytokines. Now let's go for the causes of fluid volume deficit. The first cause of fluid volume deficit is the abnormal losses of skin, gastrointestine, and the kidney. Next is decreased intake of fluid, like for example, the patient unable to take fluid due to oral trauma. Next is bleeding and the movement of fluid to the third space. Next causes diarrhea, diuresis, abnormal drainage, inadequate fluid intake, inadequate metabolic rate, like for example, fever and infection. Now let's go for the signs and symptoms of fluid volume deficit. The first one is the alteration in mental state. Next is patient complains about the weakness and thirst that may or may not accompanied by tachycardia or weak pulse. Weight loss depending on the severity of the fluid volume deficit. Concentrated urine or decreased urine output, dry mucous membrane, and sunken eyeballs. Weak pulse or tachycardia, decreased skin turgor, decreased blood pressure, and postural hypotension. That's the signs and symptoms of a fluid volume deficit, or known as hypovolemic. So now, who are at most at risk in this kind of condition? First one is the infants, like for example, under 1 year old or under 1 year old. But the most high risk and fluid related problems than the other groups is the older adult. Why? Because the older adult or older patient, they have a decreased sense of thirst. They can sense if they are thirsty or not. That develop into a dehydration or into a fluid volume deficit. So now let's differentiate first what are the difference between the dehydration and the fluid volume deficit. We all know that these two both about loss of fluid, but dehydration is all about loss of fluid or water, while the volume deficit is a loss of fluid and electrolyte. Now, let's go for the treatment of a mild fluid deficit. The first thing that you need to know or that you need to do as a nurse or as a family member of an older patient, first is urge the patient to drink a prescribed amount of water. Why? Because an oral treatment replacement is indicated to a mild fluid deficit. It is the most effective treatment for a fluid volume deficit. For the older patient that we all know, as what I said earlier, that an older patient or older adult that has a fluid volume deficit, they are mostly or commonly has or have a decreased sense of thirst. So as a nurse or as a family member of that patient, we have to be productive in selecting fluid sources that the patient prefer. Like for example, we can give them a flavored gelatin, what else? Sports drinks and frozen juice. Number 2, you have to aid the patient if they cannot eat without the assistance, or encourage the family members to help the patient when they are eating. Because a patient with fluid volume deficit may feel weak and unable to intake a prescribed amount of fluid. Third is, if the patient can tolerate fluid, give what the patient prefer. Like for example, as a nurse or as a family member of that patient, you have to give the patient a water and a straw and place it beside them. That is easy to reach. Number 4, emphasize the importance of oral hygiene. Why? Because a fluid volume deficit can make your mouth dry and sticky. So, it's very important as a nurse or as a family member of that patient that you are very attentive on their oral care. You have to always remind them to take fluid or water and brush their teeth so that we can prevent a dry mucus and dry mouth. Number 5, provide a comfortable environment to the patient. Why? Because if the room of the patient is very stuffy, it has a very possibility or possible that the patient can feel hot. So if the patient can feel hot or overheating in their body, they release sweat that occurs or that may result to the fluid volume deficit or dehydration. And lastly, number 6, plan daily activities. We have to plan daily activities for the patient to conserve their energy. Next is for the treatment of a severe fluid volume deficit. So I'm going to show to you some pictures about the treatment of a severe hypovolemia. The first severe fluid volume deficit treatment is insert an IV catheter to have IV access. It is because a parenteral fluid replacement is indicated to prevent or treat hypovolemic complication. Second is administer parenteral fluid as prescribed because fluids are necessary to maintain hydration status. Determinations of the type and amount of fluid to be replaced and infusion rates will vary depending on clinical status. Third is administer blood product as prescribed. A blood transfusion may be required to correct fluid loss from active gastrointestinal bleeding. Fourth is maintain IV flow rate because a most susceptible to fluid overload are elderly patients and require immediate attention. Fifth is assist the physician with inserting the central venous line and arterial line as indicated because a central venous line allows fluid to be infused centrally and for monitoring of CVP and fluid status. An arterial line allows for the continuous monitoring of BP. Sixth, provide measure to prevent excessive electrolyte loss, like for example, resting the GI tract, administering antipyretics as ordered by the physician. A fluid losses from diarrhea should be concomitantly treated with anti-diarrheal medication as prescribed. Seventh, begin to advance the diet in volume and composition once ongoing fluid losses have stopped, because the additions of fluid-rich foods can enhance continued interest in eating. 8. Encourage to drink bountiful amounts of fluid as tolerated or based on individual needs. A patient may have restricted oral intake in an attempt to control urinary symptoms, reducing homeostatic reserve and increasing the risk of dehydration or hypovolemia. 9. Enumerate interventions to prevent or minimize future episodes of dehydration, because a patient needs to understand the value of drinking extra fluid during bouts of diarrhea, fever, and other conditions causing fluid deficits. 10. Educate patient about possible cause and effect of fluid loss or decreased fluid intake, because enough knowledge aids the patient in taking part in their plan of care. 11. Emphasize the relevance of maintaining proper nutrition and hydration, because increasing the patient knowledge level will assist in preventing and managing the problem. 12. Teach family members how to monitor output in the home, because an accurate measure of fluid intake and output is an important indicator of a patient's fluid status. 13. Refer patient to home health nurse or private nurse to assist patient as appropriate, because continuity of care is facilitated through the use of community resources. Lastly, identify an emergency plan, including when to ask for help, because some complications of deficient fluid volume cannot be reversed in the home and are life-threatening. A patient progressing towards hypovolemic shock will need emergency care. That's all for my vlog. Thank you for watching. Make sure to subscribe and click the notification bell.